Good morning, everyone. I'm Dr. Satpal Shekhawat. I'm a GP at Curtin, Lindsay and Scott Surgery, and I'm also Medical Director for NLCCG. So this is a quick short video of how Ardens you can use a recording for patients where you're making any delay in referrals. So as you can see, I've opened up the COVID template, and on the top bar there, you can see the delay tab. So if you are consulting with a patient where you think that the patient and you are coming to a shared agreement where delayed referral for care would be needed, you can use this template. So as you can see, you can discuss about the COVID situation, benefits and risks of delayed referral with the patient. As you click them, it gets appropriately read coded. You can put down whether in your opinion referral is needed. There are some pre-filled answers here, so if you click on them, you can see the reasons for delayed referrals. So it could be patient choice, it could be lack of capacity, it could be that you've done the referral but now you're waiting on the hospital to appoint them. So you choose the appropriate code, and then you can put follow-up arranged or no follow-up arranged. There is a tab here to help, so if you click on it, it does allow you, and you can click reminder sent. You can send it via SMS, you can print a letter, or you can do a task to yourself. So if you click on that, it sends a task to me, and that would be in your diary. Now there are other ways of doing this as well. So for those of you who don't know, so I'm just going to close this template for now, but that's how you can record referral or delayed treatment in this current pandemic. Now once you have done that, if you want to do a schedule task, which is a good feature of System 1, so I have put this quick button here. If I click on this, it allows me to do a schedule task. So I can send it to myself, I can send it to different user groups. So for example, my reception staff, if I wanted to, and I can put free text there, and then I can click date. So if I decided, well, we need to have a conversation about your ultrasound scan in 3 months, you can put a task. So that's another way of doing it. And then lastly, the other thing which you can do is you can use the AccuRx. So if you click on the messaging system for the patient, I'm just going to move it up so you can see better. So in this, if you click on pathway, it gives you this calendar here. You just click on it, and you can actually reduce admin burden and send the task yourself, which will be sent to the patient on the date you choose. So there's so many ways of keeping patient informed, which will minimize risk for referrals. So thank you for listening.